Good afternoon, colleagues. Welcome to the new episode of our Journal Club presentations. Today, I present you a paper published by Hybelius and co-workers in the JAMA in 2024. The paper is useful as it provides a systematic review of two important psychometric tests, something we might be able to utilize in the emergency department to help making somatization and functional presentation not just an exclusion diagnosis, but a positive and proactive diagnostic category. Let's get started.
Today, we will discuss the measurement properties of two prevalent patient-reported outcomes, the Patient Health Questionnaire 15, or PHQ15, and the Somatic Symptom Scale 8, or SSS 8. Somatic symptoms, such as pain and fatigue, are common reasons for medical consultations and often significantly impair quality of life. The review aims to assess the reliability, validity, and clinical utility of these instruments, guiding their use in medical practice.
The authors conducted a comprehensive search of major databases, including Medline and PsycInfo, for studies evaluating any psychometric properties of the PHQ15 and SSS-8. They included over 300 studies encompassing more than 360,000 participants from diverse settings worldwide. The risk of bias was carefully assessed using established instruments, ensuring robust conclusions.
In factor analysis, both instruments captured not only a general somatic symptom burden, but also specific symptom clusters such as cardiopulmonary or gastrointestinal domains. This multidimensionality implies that the scales reflect complex symptom presentations rather than a single uniform construct. Importantly, somatic symptoms appear on a continuum rather than discrete categories.
Both scales demonstrated adequate internal consistency overall, which supports their reliability for clinical and research use. However, certain PHQ15 items performed poorly, indicating potential redundancy or irrelevance in some contexts. The SSS-8, the abbreviated version, avoids these issues, making it potentially more efficient.
The scales correlated well with related constructs, establishing construct validity. However, their diagnostic screening ability for somatoform or somatic symptom disorder was only borderline acceptable, aligning with clinical complexity. The MCID of around 3 points is important for interpreting meaningful change in individual patients.
Few studies evaluated test-retest reliability, limiting firm conclusions. The PHQ15 appears to capture symptom changes post-intervention moderately well, particularly with CBT. The SSS-8's responsiveness to change has yet to be robustly studied, highlighting an area for future research.
Clinicians can confidently use either of these instruments for assessing somatic symptom burden, keeping in mind the multidimensional nature of the symptoms reported. The PHQ15 may be preferred where detailed assessment is feasible, while the SSS-8's brevity facilitates routine screening. Importantly, individual item patterns should inform clinical judgment.
The review highlights gaps, including limited evidence on test-retest reliability and sensitivity to change, especially for the SSS-8, and the lack of information on patient and clinician acceptability. Future studies should focus on longitudinal measurement properties, cultural adaptations, and practical utility in diverse clinical settings.
In summary, this systematic review and meta-analysis confirm that the PHQ15 and SSS-8 are valuable instruments for evaluating somatic symptom burden. They capture both general and specific symptom domains, but should be interpreted thoughtfully. While they are not definitive diagnostic tools, their use supports more structured patient assessment and can guide monitoring and treatment planning.